Today I'm going to be talking to you about DAFNE, which is Structured Education for Type 1, and then on Thursday you'll be having a bite-sized session. So if you've not joined that or spoke to Adam about it, then please join that one. That's on Desmond, and that's your Type 2 education. So DAFNE, what is DAFNE? Just a few slides there, my corporate things. So a bit of background for DAFNE. What does it stand for? It stands for Dose Adjustment for Normal Eating. It's a structured education programme for type 1 diabetes, and it's based on principles from a course that was ran in Germany back in the 1980s. And since then, we've now delivered courses across the UK and Ireland since around about the 2000 mark. And what's ideal about this with DAFNE is it's a curriculum, so it doesn't matter whether you're in Nottingham, you're in Cornwall. If they are a DAFNE centre, they will be given the same information because it's a structured education programme with very strict curriculum that the educators have to follow. There was a big project, if you like, or some research that was done on DAFNE back in 2015 in Australia, known as DAFNE, because it was actually recognised that you need to have some experience or some significant knowledge with numeracy and literacy. And what the DAFNE actually developed was a separate introduction for people that don't have the skills in numeracy and literacy to follow the in-depth of the curriculum course, so that it's been slightly adapted to try and reach most population now with type 1 diabetes. What's the service that we offer? So we offer remote courses, so we do them via Teams. We also do the face-to-face course. We used to do a face-to-face course, which was a Monday to Friday, but we also now offer a 5x1 course. So we deliver 1 day a week for 5 weeks. The remote courses have almost dropped off a little bit now because we're having a lot more people preferring the face-to-face course. We're now doing an insulin pump course that is mainly delivered by our NUH colleagues. And we have an online refresher course that our participants that can actually join. So if they've done a full course previously, but then they feel they need to have a refresher on a particular module, they can actually tap into that individual module. Part of the service that we offer is that the educators who are actually delivering this session will meet the participants roughly about 1 to 2 weeks before the course starts. Just to go through what the course entails, what is expected of the participant for the 5 weeks. And then 3 months after the course, we actually bring them back for a post-assessment. So this is just touching base with the participants to see if they've got any problems or if there's any further support they're needing in relation to their DAFNE. We're very fortunate now, over the last 12 months, we've now been delivering the DAFNE programmes both within NUH venues, and we also deliver now at Sherwood Rise Health Centre, so which is where the diabetes base is. So we deliver from City Hospital, QMC, and now Sherwood Rise Health Centre, just to give that equal opportunity for people to actually access the course. Who are the team? So the team are made up of DAFNE educators. So these are dietitians, diabetes specialist dietitians, diabetes specialist nurses, and also diabetes consultants. Because what the course we tend to run the courses here in Nottingham with 1 DSN and 1 diabetes specialist dietitian. And then what we do is we invite a consultant in for a session where we keep questions for doctors. So if we're unable to answer all their questions, then they know they've got a consultant coming in that hopefully will be able to address any gaps or needs that they may have. The specialist or the DAFNE educators, we have to complete an annual revalidation. This is all kept via DAFNE Central Hub, so that they ensure that we're fully up to date with our curriculums and that we are fully up to date with any of the updates that are being provided by DAFNE. There are insulin and carbohydrate counting online courses wider for our MDT. As in our specialist team, so all of the nurses that work in the community and all the dietitians, they're actually able to access insulin and carbohydrate counting courses to help support their patients with type 1 diabetes that have actually completed a DAFNE programme. We're very fortunate in the community in the fact that, I suppose, because I'm the service manager, I try and aim that we have a DAFNE educator in every type 1 clinic that we deliver in the community. It's also CPD accreditation, so any courses that are completed, they all gain the CPD. What are the benefits of DAFNE? So the benefits of DAFNE that we're aware of is 40% achieve an HbA1c target of 58 millimoles per mole. The most significant one that I always come across is the improvement to quality of life. And the improvement of quality of life is they feel that they can actually are normal, that they can go out and eat a meal and be able to safely dose adjust their insulin by calculating the carbohydrate. They also, where the improvement of quality of life is the extreme variations. So they're not low 1 minute, then high the next, because what we do know with DAFNE, it can reduce severe hypoglycemia by 75%. And we also know that DKA is reduced by 80%. So it stops that swinging in the blood glucose levels, which means they feel they have a better quality of life and that they feel they take in charge of their diabetes instead of diabetes taking in charge of them. Improvement to treatment satisfaction, that is all down to the fact because they have a clearer understanding of the way the insulins work, they feel that they understand their treatment and they understand that maybe why they're on statins or they may be on aspirin, because we talk about the all aspects of diabetes. So we talk about what is diabetes, we talk about the way the insulins work, we talk about annual review, we talk about hypoglycemia, we talk about sick day rules. So we make sure all the core elements is incorporated in the DAFNE programme to help them manage their type 1 diabetes. This also then has a positive effect by the fact that it reduces the HbA1c by 46 millimoles per mole, and that is done over a gradual period. And what we do know that is every 11 millimoles we can reduce in HbA1c, we can reduce their potential side effects or complications of diabetes by 25%. We also know that there's a reduction in diabetes-related anxiety and depression. And all these figures are collected at their pre-assessment and the post-assessment. And then we're very fortunate that we have an administrator within our team that collates all of this information. So we always do a pre-HbA1c and a post-HbA1c, and we also look at the quality of life at their pre and post assessment. And all this information is then fed into a DAFNE central hub where they collate all this information, and then every year they share this information with the DAFNE centres. And in fact, we had a collaboration meeting yesterday talking about the statistics for 2022 and 2024. What else? So this leads on nicely about our secure national database. So we have this database where we collate all the information, and they then pull all this information to then improve or look at the gaps of the service provision of DAFNE. Each centre has a buddy from DAFNE national team. We have annual audit of outcomes. We're continually sharing best practice. And there's always plenty of development opportunities for the DAFNE educators. And then the next thing is I just wanted to talk about was the referral process. How can your patients with type 1 diabetes access DAFNE? They can access DAFNE by you need to refer them to a specialist service. So you need to either refer them to the Nottingham City Care Diabetes Service if you're a city GP, or refer them to either QMC or the City Hospital. They would need to have that first appointment with their diabetes team and discuss DAFNE, and then we'll be able to put them on the right pathway, talk about what DAFNE is, and then pop them onto that waiting list for them to access DAFNE. I've just got a little YouTube video here that I'd like to share with you about some participant feedback, which I think is good for you to listen to.
Can't hear that, Andrea. Well, I can't. Andrea, I can't hear that.
Oh, sorry, you can't. Just bear with me.
That's fine.
On mute, hang on then. Sorry, let's go back to the beginning then. On mute, it says. Let me try again. Technology, eh? Can people can they hear that now, Adam?
Quite bad control.
Yes.
I fractured both my shoulders from really bad hypos. I think this is really kind of a chance for me to spend 5 days of my life focusing on myself for once.
Mine's gone again, Andrea. Sorry. Yeah, other people have said they can't hear it as well.
Bear with me. Right then. So just want to open the floor up to any questions that people may have. I know it's a whistle-stop tour, but it's just to make you aware what's available to your type 1. Oh, hang on. Oh, technology, look.
Yeah. Anything needed, Andrea?